From KETK, you're watching East Texas Live.
Welcome back to East Texas Live on KETK. Joining us now is Dr. Nwelue with Baylor, Scott & White Health, here to talk to us about newly proposed mammogram guidelines. Good morning, Dr. Nwelue. How are you?
Good morning, Tori. I'm doing well. Thanks for having me.
Yes, and so kind of tell us a little bit, what do people need to know about the screening process?
So the guidelines have changed, and this is very important because breast cancer is the second leading cause of women deaths due to cancer in America. The big change is instead of getting your mammogram at age 50, the recommendation is that you start at age 40.
Okay, and so is that the biggest change to the program, is the age change?
That is the biggest change. The task force is also looking at the breast density to see if that's something that needs to be considered when we're making recommendations, but at this point, the main change is the age.
Okay, and so have the screening numbers gone back to normal since post-pandemic?
That's a great question. We're starting to see more women coming back and getting some of these screening tests for cancer, but they still seem to be a little bit lower than they were before the pandemic.
Oh, well, why is it so important then to get a screening?
It's really important to prevent breast cancer. And this is a diagnosis that if diagnosed earlier and treated earlier, you're more likely to survive. It's very important for women of Ashkenazi Jewish heritage and African American women. African American women have a 45% higher chance of dying from breast cancer. And this is very, very important, especially in these groups.
Yes, it is. And so how often should someone get a screening?
So starting at age 40 and then every other year at this point for the average risk or average woman. That could be different though. If you do have a high risk, maybe a family member with a history of breast cancer or the BRCA gene that you may have heard of in the family, those folks are at higher risk and really need to talk to their doctors about when the best time is to start screening.
Yes, and speaking of that, when should we start talking to our doctors as women?
That's a great question. If you know of someone in the family, especially a close relative, be that female or male, who has been diagnosed with breast cancer, I would go ahead and start that conversation with your primary care doctor or your OB-GYN and let them know. Putting it on our radar is helpful for us. We may ask follow-up questions about when was the patient diagnosed, but that's going to help us keep you safe and make sure that we're recommending the right timeline for you individually.
Yes, well, where can people find out more information?
So the CDC has the website that has the new recommendations up now. The time to close for giving comments, so we as the medical field have the ability to say, hey, have we considered this and that? That closed on June 5th, so we anticipate that the final recommendations will go widespread very soon.
All right, well, thank you so much, Dr. Nwelue, for joining us today, and I hope you have a great rest of your day.